The Honourable Member for Hasluck.
Mr Deputy Speaker, I rise to speak against the National Health Reform Amendment, National Health Performance Authority Bill. I do it on the basis that I am part of the Joint Parliamentary Committee on Health and Ageing, at which we looked at this. However, reflecting back on the legislation, revisiting the Council of Australian Government's website, and then recasting my mind back to three significant bodies that exist at the national level that work in concert with state and territory jurisdictions, I came to the view that, to me, we're duplicating an area that, if it was tweaked within the three bodies that currently exist, then it would be much more effective use of taxpayers' money. The proposed bill will amend the National Health and Hospitals Network Act, which established the Australian Commission on Safety and Quality in Healthcare as an independent statutory committee. I listened to the member for Hindmarsh, and his comments in a number of areas were important comments. But I think there are elements within the health arena that we have to seriously consider when we establish bodies to take on that national role of collecting data, reporting, monitoring, and how that information is used. Because I think so often the complexity of health is not considered in its fullest context when you consider each state and territory are at different points within the way they implement services. Their priorities are based on state and territory needs. The other element that we can never capture in data is the human element. There's absolutely critical in the way in which the health workforce plays a very critical role in improving health outcomes. This bill will establish the authority, and it will monitor and report on the performance of the local hospital networks, which is still evolving, public and private hospitals, primary healthcare organisations and other bodies that provide health and healthcare services. What I always found fascinating is that when you go to the COAG website, you have what is a list of those agreements that have been developed under the Council of Australian Governments and with the involvement of health ministers within each of the jurisdictions. And so we have the National Health Reform Agreement. We have the National Partnership Agreement on Improving Public Hospital Services, the Expert Panel Report, the National Healthcare Agreement, Intergovernmental Agreement on Federal Financial Relations, and we also have a brief summary of the Commonwealth investments in public hospitals. And if you look at these NPAs or National Partnership Agreements, you'll see the structure of them. They talk about what is the focus of the work and the outcomes to be achieved, but they also identify the reporting elements within each of the agreements. And with states and territories, through both the COAG process and the reform under the Rudd government, and through the Australian Health Ministers' Council and the Australian Health Ministers' Advisory Council, which were the Director-Generals, then there was a broad agreement on what the measures should be, and there was rigorous debate through the Australian Health Ministers' Advisory Council on the type of data that needed to be collected, how it was to be used, and what reforms would take place and how that data would underpin. But the emphasis was on the states and territories. And when you read through these, you will see, and I would invite any member who has spoken today to not restrict themselves to the Act or to the proposed bill alone, but to look at those other elements that have been negotiated over a period of time in reaching directional setting objectives for the reform of the healthcare system and the delivery of services, policies and programs. But a point that I also want to make is that the data that is collected is produced in reports, and there's something like 28 reports from a number of minimal data collections. And these data collections are reports that are either released biannually or there are arrangements in the time period for which they are investigated, the data is collected, a report is done. I know in terms of Aboriginal health, if you want a particular state slant on the data, you then, as a jurisdiction, pay additional money to the relevant agency, and I'll come to that agency shortly, and you receive a WA-emphasised report, or you find it based on your jurisdiction. And I find it fascinating that if we've got so many data sets and so many collections and reports, then why aren't we using those? because in a sense they have a historical basis. Why do we need to establish another authority that collects data and then it doesn't tell me what it's going to do with it? We talk about reform. But when I consider the burden of collecting data, you are taking people away from frontline services. You are taking them away from delivery of health care that is needed at the various levels within each of the state and territory jurisdictions, including the primary health care providers. It is a cumbersome process. If we want a healthcare system that works, then don't tie people on frontline services to collecting data that feeds a beast that has been established in Canberra. To me, this is a centrist approach, and what we'll see again is a grab for the control of the health agenda. To me, the Australian Parliament sits at the heart of Australian federalism, and the Australian Parliament continuously positions itself as a dominant player in the national political deliberations, but does not have exclusive responsibility. We have state and territory governments who are the front-end providers. Professor Brian Gallagher, in a paper titled Politics and Public Administration Group on the 26th of June 2001, in a paper titled Parliament's Development of Federalism, states the following, and I quote, "The national government was given defined powers, either exclusive or concurrent, whereas the states retain the residual. Where there is an overlap, Commonwealth law prevails to the extent of any inconsistency." Mr Deputy Speaker, it is my view that this bill will provide the Commonwealth with authority over the states and territory governments, and this will be extended by practice through the implementation of public sector erosion of the responsibility of states and territories. Because when you've worked in that sector, and certainly you protect the area in which you work, and if you have a leadership role, then you certainly identify those very key things that you want to achieve within this framework. To me, it is a control by stealth. By adopting a written constitution, notions of parliamentary sovereignty were confined by the terms of the constitution itself. Support for a federal rather than a unitary constitution was unanimous amongst the delegates in 1891 and 1897 and 1898 conventions, because the states were wanting to protect their responsibility in the provision of frontline services, and health is a key area that states and territories deliver consistently at the local level. And those programs and services are often shaped by those who are the recipients. And certainly we use data about elective surgery waiting lists. We use data about time spent in emergency departments, but we've also got to consider the drain and the pressure on healthcare systems. Both Parliament and federalism are core features of the Australian Constitution. It was to create an indissoluble federal Commonwealth based on the consent of the people of the Australian colonies. Mr Deputy Speaker, the bill will change the title of the Act to be the National Health Reform Act 2011. It amends the current Act to distinguish between the two new authorities and introduces provisions relating to secrecy and disclosure of information. Why would you want secrecy if we are being transparent? Why wouldn't we want to make sure that everybody had the information that is being collected so that it is relevant and is seen by all? These authorities were the first set of commitments made under the Rudd health reforms and outcomes of the COAG meeting that was held in April 2010. I spoke against the original bill and questioned the need to establish three new authorities given the existence of the Department of Health and Ageing, the Australian Bureau of Statistics and the Australian Institute of Health and Welfare. I want to turn to these three bodies because, firstly, the ABS states, and in the Australian Bureau of Statistics Act 1975, it states that the Australian Bureau of Statistics is one of the many providers of statistics, albeit the largest, that are used to inform research, discussion and decision-making within government and the community. The organisations and arrangements, formal and informal, which together provide such statistics, form Australia's national statistical system. Section 6.1 of the Act states, and it outlines the functions of the ABS, and I want to cite two of these, to constitute the central statistical authority for the Australian government and by arrangements with the governments of states and territories, provide statistical service for those governments, and to collect, compile, analyse and disseminate statistics and related information. Why wouldn't you use the ABS and extend its role and function without having to create another layer of bureaucracy? Secondly, the Australian Institute of Health and Welfare informs community discussion and decision-making through national leadership and collaboration in developing and providing health and welfare statistics and information. The Australian Government, through AIHW, collects health and welfare related to the information they seek, the statistics, and then develops specialised statistical standards and classifications relevant to health, health services and welfare services in conjunction with the ABS. The AIH is prescribed as a Commonwealth authority under the Commonwealth Authorities and Companies Act, and it has a leading role in supplying national data for reporting on a range of performance indicators and output measures for the national agreements adopted by the Council of Australian Government. The Institute develops, collects, analyses and reports high-quality national health information, and I have been a user of those reports, and the information contained in those reports are very informing, publicly available, and help with some of the planning directions that need to be set. AIHW works with the Australian governments, state and territory governments and other stakeholders to ensure that high-quality and consistent data and information are available to underpin the COAG reform agenda and the health reform agenda. And finally, we have the Department of Health and Ageing, which has a broad functional role, but that is still one of the key Commonwealth bodies. So we have three significant bodies that if I was in the position of determining whether we need another one, I wouldn't. I would argue that we use those bodies effectively, send the money and funding to frontline health services that are badly needed in rural and regional Australia, and then through the hospital networks. It is a pity when we become consumed with the establishment of additional bodies that collect data, that report. And certainly the Senate inquiry had its own findings in respect to the legislation. West Australia, in correspondence signed off by the Premier of Western Australia, made the following point. Firstly, in relation to the scopes and functions of the NHPA, the bill is currently drafted allows for the possibility of the real work of the NHPA could be broadened in scope beyond the contemplated by the heads of agreement. So in other words, there's a capacity to extend its role and function. And there is not a requirement, as the WA letter goes on to say, to go back to and deal with those issues. In a major rebuff, the health ministers in a communique made comments and stated that health ministers agreed that states and territories are the system managers and as such the performance managers of public hospitals in Australia. The Performance Authority will report on the performance of hospitals and health networks, and these reports will be provided to state and territory health ministers as the system managers prior to public release. And then they go on and talk about the watering down of powers, the role of the NPA, empowering state ministers and requiring the Commonwealth Minister to seek state ministerial and, in some instances, COAG approval for the role of the authority. This is not a bill that I would support, and I would certainly support its referral to a Senate committee to have a look at the issues within the bill, to identify and look at how the roles and functions of those three existing Commonwealth authorities operate and provide that service now, but also to look at the cost effectiveness of the use of taxpayers' money, which could be better directed to frontline services that will see the reduction of elective surgery lists, that will see better health care being delivered at the point of need, and that it underpins and supports the local Medicare networks that will come into place. I believe that we do need real action and real reform, but there is also a reality that in this day and age that we don't have an endless bucket from which we can pull all of the initiatives that are being announced and all the bodies that are being established under various pieces of legislation. And this is one where I'd ask the government to be much more considered in the establishment of this authority, be more frugal in expenditure and utilise the existing resources that are currently there in place that have served health systems at state and territory level and at the Commonwealth level. There are also the COAG processes that complement the work that they do. Thank you, Mr Deputy Speaker.